Let me, yeah, okay.
And then you all send me the recording also, okay?
Yeah, definitely. Okay, I'm just introducing you, Sakshi. I'm introducing him.
Yes.
Dr. Cyres Mehta is an ophthalmologist. He is very well known eye surgeon, and he has performed several eye surgeries with about 20,000 with the latest technology since 215. He has been the winner of several awards, and he has this latest technology, which is called the robotic micro-incision laser cataract surgery. It's very talked about, very well known, and people are just rushing across for this because obviously it's a much easier way to get it done. So now he is going to explain to us about this type of surgery as well as other eye care. Right, doctor?
Yeah.
Yeah, over to Dr. Cyres Mehta.
All right. Thanks very much, Asha, for having me and the people at the Tulsi Trust. I know Mr. Naval Pandol very well, and he kind of suggested my name because I've operated Mrs. Pandol and probably many other relatives and friends over the years.
Yeah.
So basically, my talk for today is robotic laser cataract surgery and then some other diseases that afflict the older generation and older people, and it's important to know about it. Yeah, let's take a look at the eye. Can you all see my screen?
Yes, we can.
Yes, all right. So basically the eye, the camera has been copied from the eye. So just like a camera has a lens, the eye also has a lens in it. And the lens focuses light on the retina or the light sensitive layer at the back of the eye. Just as light enters a camera and forms an image on the film behind, the same way the light enters the eye and forms an image on the retina. And that's how we see. This is called the visual pathway. And this is a very nice and complicated thing that they taught us in medical school. But basically what you need to understand is that you will see on the top of the picture, there's a blue. So the blue area is on the right and the red area is on the left. But if you look at the brain and the back part of the brain, you will see that what you're seeing on the left side is seen by the right side of the brain. And what is seen by the right side is seen by the left side of the brain. So that's an interesting thing. So if somebody hits you at the back of the head on one side, you will lose vision on the other side. So why this funny kind of arrangement? This is done in such a way that if a person sustains a bad injury to the brain, he doesn't lose vision in one eye completely. He loses half vision in one eye and half vision in the other eye. So he can still function. So that's why it's been created like this. So we also have something called visual illusions. So if you look at these two balls, Asha, if you're looking at the two balls, you tell me which one is bigger. Yeah, you've been muted. So basically the one behind is bigger. It looks
behind
bigger.
is bigger.
Yeah, actually the one behind is not bigger. Both are the same size. So this is a visual illusion where we actually think. So it's not the eye that really sees. The eye just takes electrical energy or light energy and converts it into impulses. And then the brain decodes all this and gives us the phenomenon of sight. So finally, what is cataract? So the lens inside the eye starts becoming cloudy with age or with diseases like diabetes or some other problem like a blow to the eye, and becomes cloudy. Like we see in this picture here, and you can see that's cataract. That's two separate pictures. Small children also get cataract. Babies are born with cataract because of infections their mothers have, or due to lactose intolerance or some other diseases that they suffer. And you can have congenital cataract. The child is born with a cataract. This looks like a star. You can see that. And then we have the good old-fashioned old age cataract, which all of us will get. I always say, if you live long enough, you will get cataract. So people say, you know, my mother lived to 75, but she didn't have cataract. I say, well, you know, if she lived to 80, she would have developed cataract. So eventually, if you live long enough on God's green earth, you will develop cataract. There is no human being that doesn't develop cataract. They may not complain of it. They may sit alone at home and not see, but cataract they will have. So why do we get this disease? Either at birth due to some infections, UV rays. That's why we always say that wear good pair of dark glasses, otherwise you will develop cataract early. All the people in Sasundok who go on the ship and they go fishing and all, even the young men who are 40, 45 years old have cataract because the UV light bounces off the water and goes in their eyes. Food contamination, abuse of steroids. People take certain steroid creams for rashes, allergy, steroid for other diseases like rheumatoid arthritis in old age. This causes cataract. Diabetes is a big contributor for cataract formation. Chloroquine, COVID caused cataracts during COVID. People had a large dose of steroids for inflammation in COVID, and all of them developed cataract. And after the COVID season got over, I had hundreds of cases to operate with cataract because a lot of them were treated with large doses of steroid in the hospital. Interestingly, very malnourished people or malnourished children also with those bulging stomachs and all, they develop cataract. So cataract is also a metabolic disease where a disease like diabetes or a disease like malnutrition can also cause it. All those boys who are making your kebabs at Bade Mian and working on that sigdi, they also develop cataract because of infrared light or that red light. In India, nobody wears all these protective glasses and all. That's why they develop. So you will find a 30-year-old boy there working with cataract. And of course, we all know that aging causes cataract. So age is not the only cause of cataract. Age is one of the causes of cataract. So what to do about it? In the olden days, people tried all kinds of eye drops. When they would come to my dad or to any old-time eye doctor, they would give them some iodine eye drops and all and say, ye dalo. Of course, it didn't work. So there is no medical cure. Just like there is no medical cure for fracture. If you have fracture, you have to put plaster or you have to go to the doctor and put a pin or you have to do a surgery. Just like there is no medical cure for fracture, there is no medical cure for cataract. Surgery is the only option. In the olden days, 50, 100 years back, surgery was a very horrible adventure because there was no anesthesia. They would cut you, patient will be screaming, and they would do all kinds of horrible operations. They would cut the eye open and pull the cataract out and all. And I've seen all this in the 80s and early 90s when I went to medical school. We were still removing the cataract like this by making a big cut in the eye with the scissors and then pressing on the eye, and it would pop out. It looked like that white Cadbury's gems, the white one. That's why it was called motia, because when the olden time people saw it, they say, ye to moti ke jaisa lagta hai. So that's why the name motia came in India. And the Arabs studied medicine 1,000, 2,000 years ago, and they called it white water or mai abiyat, which means white water. So they saw the eye has got white water, and that's why the patient can't see. Now, of course, all these days are gone and we are using a laser robot. So this is much better. Most eye doctors do what is called phacosurgery, where a needle goes in the eye and breaks up the cataract using ultrasound energy. They call this laser, but actually it is not laser. Laser is a beam of light and not an ultrasound needle. Now, most eye doctors say we are also doing laser, but the strange thing, there is only 5-6 machines in full Maharashtra, but there are 6,000 eye doctors in Maharashtra. So everyone cannot be doing laser. The reason is the machine is very expensive. So this is like the chicken and the egg. If you don't have enough patients to operate, you can't afford to buy the laser. And you can't buy the laser without having enough patients to operate. It's like that. And there's a per procedure cost. So the company like Johnson & Johnson or a company like Alcon, Nestle, they are the big companies that own these machines and they want to make money. So like all good American companies, every time you use the machine, you have to pay them a fee, because of which the cost of the procedure is higher than a conventional surgery, not by much, but it is higher. Now, instead of giving a big talk about this, let's show a video. So I will play the video directly because for some reason or the other, it doesn't want to play in the presentation. So it doesn't matter. We will play it directly. Can you all see this video?
Yes, yes.
Yeah. So this is a video with a young lady that I'm operating for cataract. You can hear her speaking. This is the robotic laser system. So I operated one of her eyes, and 4 or 5 days later, she was completely normal and she had gone back to her normal life. That's what she's saying. Now we are operating the other eye. So it gives us an idea of how a patient actually feels. Rather than some, patient just telling, it was very nice and all. You can actually see the procedure, how we are doing it. We first put a little clip to hold the eyelids open. So, and you can see that there is no injection, there is no pain, patient is not doing or shouting. It is so comfortable. The machine looks inside the eye, it sees that cataract. We decide how the laser is to be applied. And if you notice, I am not inside the eye, the machine is doing everything. I am operating a machine. The patient is connected to the machine. So this is like an automated system. You can see that. So it takes only 30-40 seconds. You can see that. So it says 30 seconds remaining. So it's that quick. So people say, really, cataract goes in 30 seconds? I just see the video. See for yourself. So the machine fires the laser like this, which is a beam of light. So of course, there is no sensation of pain and things like that because we are not really cutting the eye. So there is no pain. That's why I've not edited the video. Let it run full 30 seconds. You can see the laser energy is melting the cataract inside the eye there. Right? So now that procedure is over. We are going to go to the next room where we'll suck out the melted cataract. So now this cataract has been melted. Now we take auntie to the next room and put the lens. So we show you. She gets up by herself. She goes walking to the next room. So you can see the human lens has been cut into multiple pieces. You can see that there's 1, 2, 3, 4, 5, 6, 7, 8 pieces. And this is a diamond separator, not a knife. So the openings have already been made by the laser system. The laser system has made a perfect opening there, which we just remove. We put some fluid in the eye. You can see that's the cataract. And we don't use any ultrasound energy. We are just sucking it out with suction. So there is no chance of burning the cornea. In the olden days, when cataract was hard, in old age, we all heard of cases where the eye got spoiled after the surgery. That's because the ultrasound energy would potentially burn the cornea. And the recovery would take 3 months, 6 months and things like that. Now we don't use ultrasound energy anymore. That light energy has melted the cataract. Now we will implant the lens. So this comes like this in a pen. You can see that. You hold it in your hand like this and it enters through 2 millimeters. So the lens goes in the eye like this and opens, unfurls in the eye. This is in real time. This is not an edited video. So you can see how few seconds this procedure actually takes. These are the 2 legs of the lens that hold it in place. So we position it. So this is my job. Machine cannot do everything. Something I have to do. And that's the end of the surgery. So the cataract, which is the opaque human lens, is melted and replaced by an artificial lens. Now let's go back to that presentation.
So is this a dual lens you put for far and
Yes,
near?
correct. Yeah? That's a trifocal lens that you are looking at.
Okay.
So let's go back to the presentation. This one video just refuses to play in it. I don't know why. Let's see cataract in small babies. We always wonder, how does the doctor operate a baby that is so small? So the baby is only so small. So all the instruments that we use are also microscopic. So let's have a look. Here we are. So this was a little baby referred to me, 3-4 months old, from UAE. So this was a congenital cataract. So the patient had come with certain deformities in the eye. You can see that's the little boy. We have put him to sleep with anesthesia. And that's the white cataract. This is the referral note which has come from Oman. So that's the cataract, the white area in the center. So little babies like this we handle differently. It's not like an adult cataract. Everything is different. We have a separate tunnel into the eye like this. Then you use a microscopic forceps. That forceps that you are seeing in the eye is as thick as 2 human hairs. It is like less than half a millimeter, because this entire eye that you are seeing is so small. Here there is nothing to melt. The cataract is liquid in a child, and it already has a hole behind. I don't know if you all can see that, but there's a hole in the center. So that's the congenital deformity. So there's special lenses for children which we inject in the eye like this and put it into place. Now you all can see that hole behind. So these are technically difficult cases. Then I get referrals like this from all over the world, because most surgeons don't know how to do this surgery. So they send to the people in the country where they know that you can do it. Otherwise, this child would grow up blind. This is the back of the eye, which has all these issues. You can see all that stuff, and we go behind also and clear it up. So you do a combined surgery, front and back of the eye at the same time. So that this is the child waking up from anesthesia. Let's have a look at the next one. You all are not getting bored, no?
No.
Okay. So this is a little child I had operated when it came to me as a baby, a few months old. This is the child at 2 years old. Child was blind and came from Uttar Pradesh, where, the parents didn't know what to do. They were illiterate. They were broke. They had no money. And that's the situation where the healthcare system fails them, because they have no one to support them, no one to help them. So I get kids like this from the hinterland and some small town and all, and we just do the surgery because they can't afford it anyway. And if they go to some government hospital, that will be the end of it. So you can see that after implanting lenses in both the eyes, the child can actually see the phone and is following the phone. Otherwise, the child was totally blind and listless. Now the child wants to see cartoons on the phone. So that's the benefit of doing cataract surgery in little children. Anyway, now cataract is over. Now let's talk about glaucoma. Glaucoma is a major health problem all over the world, which we are not aware of because it is not publicized much. Interestingly, in the new health program of Government of India, glaucoma has been given a lot of importance along with diabetes, because 7% of the population will become blind if their glaucoma is not treated. Now, we may think 7% is not the whole population, but 7% of a country with 200 million people is more than the population of Europe. So there will be more blind people in India with glaucoma than all the people living in, all the human beings in Europe, if untreated. That's why it's very important to sensitize people or make them aware that such things are there and we should treat it. And what is this glaucoma? Patient tell me, doctor, have you checked my eye pressure? That is glaucoma. Basically, we have to check the pressure of the eye. When we go to an optical shop and we just do a spectacle number checkup, 3/4 of the eye is never examined. And that's why people have these issues and they don't know. So you must go to an eye doctor and not to a spectacle shop to check your eyes, because there they don't have the machinery to check eye pressure and to look inside the eye. The eye needs pressure to keep it shaped, just like air in a football. If you take away the air from a football, it becomes flat, like a balloon that has collapsed. But too much pressure presses on the optic nerve and is bad. This presses on the optic nerve and eventually causes blindness. This disease has been there in India for hundreds of years. Everybody knew about this. And even in Arabia and ancient civilizations, as far back as ancient Greece, people knew that there was a disease called glaucoma, where the eye becomes hard and the person becomes blind from the time of Hippocrates. That is more than 2,500 years back, before the time of Alexander. So this is being called Jhamar or Kala Motia. Patient will come and say, Doctor, mujhe Safed Motia hai ke Kala Motia? They are asking, do I have cataract or glaucoma? Glaucoma is the silent thief of sight. It has no warning signs. Your vision doesn't reduce right till the end. And this is why it is dangerous. When we have some cavity in the tooth, we go running to the doctor because it is paining and we can't eat. But imagine if there was no pain, you would not know until the tooth fell out. So this is the problem of glaucoma, where people end up blind because their vision doesn't decrease right till the end. That's why it's important to check for this. Everyone over 40 must have an eye pressure checkup. If glaucoma is found, we must stabilize the pressure and test the eye regularly with a machine like this. Patient puts their head inside the machine and sees spots of light. The machine shows spots of light, and every time the patient sees the spot, they press the button, and that response is recorded on a screen. And we get a printout like this, which tells us what percentage of the vision is already affected. We put patients in front of a machine like this nowadays, which is an automated machine. This looks inside the eye at the optic nerve and at the retina and checks everything. So I don't want to become very technical, but you can basically see at the bottom, there are these round things, and you can see first, second, third, the red area is increasing. So that's the glaucoma. Okay. Also, we look inside the eye where the fluid is flowing out. You see that arrow in the picture? The eye has a certain fluid called aqueous humor. This flows out of the eye from the path of that arrow. So when that gets blocked or obstructed due to cataract formation or due to glaucoma, the eye pressure goes up and leads to blindness. So we have machines to measure all this today. It takes photographs of the optic nerve like this. We can treat the glaucoma with eye drops, but nowadays we prefer to do this treatment called SLT laser. So in the clinic, you can see this green flashes of light. So we are lasering the pathway of the eye from which the fluid flows out. It is all choked up, like your pipe in the bathroom gets choked up and then the water doesn't go out. So this unchokes the pipe and the eye pressure comes down. So this is what it looks like. When I'm looking inside that machine, this is the red spot of light. That's the laser beam. And every time I fire the laser, you can see these small bubbles. That's the effect of the laser beam, which is reducing the eye pressure. So that's actually what I'm seeing inside the eye at the time of the procedure. Sometimes we have to do surgery. There are new surgeries. That's me 25 years ago in America, learning the surgery from the inventor. So you can see I had all hair on my head. Now it is all fallen out. But that time I had lots of hair. And this was 25 years back, young Cyres. That's in the operating room in America. So now let's go to laser vision correction. This is a very popular thing. I get a lot of kids, 20, 25, 30-year-olds. People say, "Yaar, beti ka shaadi karane ka hai, uska chashme ka number nikal do." This is the most common cause in India of doing surgery, laser surgery, is marriage. बेटी का ऑपरेशन लेजर से नंबर निकालने का है, किसका शादी हो जाएगा. ऐसे चलो, come on. But nowadays, equal number of men also want to do it because they don't want to wear specs. They want to play sports. They want to run. They want to cycle. They want to swim, and they don't want to wear specs and look funny. So we do this laser vision correction for myopia or hypermetropia, minus number or plus number. Old laser technology had all kinds of issues like dryness. It didn't work very well. The number came back. So we have a new laser technology, which is the first time, called SMILE, in which there is no cut on the eye. So let's have a look at this. Let's see the video. So this is the SMILE procedure. This is exactly how the patient undergoes it. So that's me. That's the SMILE machine. That's not a bunch, it's a clip. So just I'm talking to the patient during the procedure.
Tendency is that
The machine comes and connects to the eye. You can see it's all automated and does the laser.
Looking that green light is excellent.
So that's the laser procedure going on. Of course, it's completely painless. You can't feel anything. It's a light beam. When we just separate the layer inside, that's gas bubbles. The white things you're looking at are basically gas bubbles inside the cornea. So we just clear off all the gas bubbles in one layer. That's the end of the laser vision correction. That's it. And the person's spectacle number goes away. Finally, let's have a look at macular degeneration. I included this topic. So because, we have so many senior citizens here listening to this talk, and at least 20 to 30% of you all will be having macular degeneration, where the central part of the retina gets affected and affects your vision. If you see this picture of this young man and this couple, you will see that if you have macular degeneration, you will see like the picture on the right, where the center of the picture that you look at will not be seen because the center of the retina is affected by the disease. In the olden days, we used to do laser and all, which didn't work. Nowadays, we have new medicines that we give by injection in the eye. And just one injection cures 80% of the people. And it's very successful, and millions of these are given worldwide. So all these diseases are treatable if caught early. If caught late, there is no treatment and the central vision goes away forever. There's a new artificial retina which is coming, and new stem cells where you can just make blind people see again. Just like in the movies, you see that robot with that eye that looks like that. So we are doing that now, and we connect it to the brain with a wire that goes behind. And the person can actually see again. And these experiments are ongoing. And I would say within 10 to 15 years, it will be a reality. All of us sit on the computer. Right now, we are sitting on a computer only. And every day I get so many people with computer vision syndrome, where they get headache, blurring, tired eyes, and things like that. And that's because the human eye is not evolved to look at a computer screen. It's evolved to look at reading matter over hundreds of years. And now computer is a rather new invention. So what happens is that the muscle inside the eye keeps contracting and gives the person a lot of irritation in the eye and headache. Also, it's very, very bright. The new screens are very bright. So you should wear those blue blocking glasses that you see advertised. And also when we look at the screen, we stop blinking. So when we don't blink, the eyes get more dry, and we work in the air conditioner. And the air conditioner dries the eye even more. And if you don't have AC, you have a fan, and that is also drying the eye. So when you're old and you're sitting in front of the computer screen, you're developing more and more dryness in the eye. So how do we prevent this? Every 20 minutes now, look into the distance. So your eye muscle becomes relaxed. Sit near a window. Now, this is not practical for everyone because everyone doesn't have a house with all windows where you can look out of. But if you do have, good. Make an effort to blink more often and put artificial tears. Adjust your workspace accordingly. This is diabetes affecting the inside of the eye with all kinds of bleeding and leakage. Whenever I have a diabetic patient, I tell them that, see, if you don't control your sugar properly, later on, you're going to have an issue. And finally, some other retina diseases that we treat with surgery. So this is the end of my talk today. And now you all can ask me questions.
Good evening, sir.
Hi.
Hi. Thank you very much. Very nice, informative lecture. But we could not write the note. I was trying to write.
But this video will be there on YouTube. You can see it anytime.
Yeah, thank you, sir. I would like to ask you something that babies congenital, you said it is,
Yeah.
is it due to mother's severe diabetes or any infection
It
the
can be,
child
yes.
must have got?
Yes.
Acha. And one more thing, sir. My daughter now, she is 43 years old. She has got, I think, right side or retina. Some blinking was there before, some means last month. And they have started steroid drops and all. She wanted to come to you after taking
Call her.
appointment.
Call.
She wanted to show you.
We'll
They have
see.
given steroid orally plus steroid drops. And
So
some
something
sort
will
of swelling and some this thing was there. Now also she is
ठीक है ना
putting eye
आंटी,
drops.
उनको भेजो मेरे पास, मैं देख लेता हूँ.
Where, sir, it is? Your this thing is
In front of Kolaba police
consulting.
station. This is the lane in front.
I think I had been there.
I think you can,
Okay,
doctor,
sir.
you can put it up in the chat or something,
Yeah.
your number, and they can contact you.
Yeah.
Thank you, sir. Very nice lecture.
Thank you.
Thank you very much.
Hello, doctor. This is Priya Ramchandani.
Yeah.
I'm an old person, but I've been operated for both my cataracts since 10
Yeah.
or 12 years.
Yeah.
And I'm fine. My eyesight is okay. I mean, I've got a very small number, which I'm using my glasses for
Yeah.
that. But other than my far sight is perfectly all right. It has become okay.
Yeah.
There's no problem. So
Yeah.
when I do go out, as you said, you must wear dark glasses. That's important. So I do wear that. But since
Yeah.
last 6 months, doctor, my eyes have become very, very dry. So much dry that I feel thirsty in my mouth all the time. I have to drink sips of water every now and
No,
then.
so then the dryness is not only in your eyes. You have
Yes.
got dryness in the whole body. So this needs to be investigated by a good physician.
I see.
Yeah.
So I consulted a neurologist also, but he said that nothing to do. I have nothing to do with the eyes. That's nothing to do with me. So I went to my eye doctor specialist who did my cataract. So he said
Yeah.
this eye dryness of the eye comes with age. Is it due to age? Yes. Hello?
Sometimes.
Okay. Yes. So because I'm 80 plus now, so it's happened at the age of 80. So it comes
Yeah,
because of age. And one of the doctors whom I consulted about 6 months back, she said, you'll never get tears in your eyes, which I was very, very sad to hear that, because I do cry often and I get emotional. But I found in the last few months, I become so emotional that tears are coming out from my eyes. So that is not a problem issue.
Yeah.
But because of the dryness, I feel very uneasy in the eyes sometimes. So I've been putting a few drops like this XLHA drops. Then, refresh tears, and then she's given me also UV lube eye drops.
Yeah.
Now, will that help in the this dryness?
It can.
I
Depend.
see. Anything else you can suggest for my dryness? Because they are so dry that every 2-3 hours I have to put these drops.
No, I don't think anything else can be done.
Nothing else can. But are they this dryness? Will it cause blindness or anything like that to my eyes?
No, nothing will happen.
Nothing will happen. I mean, it
No,
will continue. It will continue for some time, right?
Yeah.
But so I just put on drops. There's no other cure for that.
No.
Yeah, that was my main worry. I wanted to know about that.
Sure,
Thank you, doctor. Thank you, doctor.
All right.
Thank you.
All
Thank
right.
you.
Sir, excuse me again. Resolving vitritis, few snowballs in inferior periphery for
Auntie,
right
that
eye.
is your daughter's case. So the steroid is correct.
Okay. Thank you, sir.
The treatment is correct.
गुड इवनिंग डॉक्टर, गुड इवनिंग एवरीवन. अगर किसी और को क्वेश्चन है तो like they can ask one by one to the doctor so he can answer properly.
I have a question.
Yeah.
Okay, go ahead.
मुझे क्या है ना, मुझे दोनों आंख में कैटरेक्ट है, तो मैं एक अभी करवा के बाद में 1 वीक के बाद दूसरा कैटरेक्ट निकाल सकती हूँ?
आंटी, today with the new laser, आप दोनों आंख साथ में भी कर सकते हैं. आप 1 हफ्ते का इंटरवल भी ले सकते हैं.
अच्छा, तो दोनों आंख को साथ में कर सकते हैं, उसमें कोई रिस्क नहीं है?
नो, लेजर से करेंगे तो रिस्क नहीं है.
हाँ लेजर से ही करेंगे. और दूसरा क्या है, मुझे स्पेक्स है and I don't want specs.
Specs
Just now
भी
you told
specs भी
that
निकाल.
I'm about a 77-year-old.
You will become
तो
spectacle free.
हाँ जी.
You can become spectacle free.
ओके. तो बाइफोकल लेंस भी अंदर डाल सकते हैं दोनों.
Trifocal.
ट्राइफोकल. ओके.
हाँ जी.
So it can be done.
Yes.
और कुछ बाद में कुछ ऐसी कुछ ऐसी कोई शक्यता है कुछ इंजरी होने की, क्या ऐसा कुछ?
ऐसा नहीं होता है आजकल आंटी, सब अच्छा हो जाएगा.
अच्छा अच्छा. थैंक यू वेरी मच.
Thank you आंटी. Thank you.
किसी और को क्वेश्चन पूछना है डॉक्टर को?
So I have put up my address and my phone number on the chat. So you can circulate that to all the participants.
Sure,
And if
sure.
they have
Doctor,
any
I will do
questions,
that.
they can send me a WhatsApp also.
Okay. I will WhatsApp you so you can share the details so we can share with all the participants.
Yeah.
किसी और को क्वेश्चंस है कुछ?
हाँ मुझे ये पूछना है कि रोबोटिक का आप कर रहे हो, कैटरेक्ट का ऑपरेशन आप कर रहे हो? अच्छा.
नहीं करता.
तो मैं अगर आप कह सके तो अच्छी बात है कि कितना खर्चा होता है?
आंटी ये ऑपरेशन 40,000 से चालू होता है.
नहीं, सबसे अच्छे में अच्छा लेंस डालना है और सबसे अच्छा करना है.
आप दुनिया का सबसे अच्छा लेंस डालेंगे और रोबोटिक से कर 1 लाख से ऊपर जाएगा.
1 लाख से ऊपर?
Yes.
For one eye?
For one eye.
Oh, okay. So it's a good, no, if robotic is done.
Yeah. Robotic is, so, you know, today many doctors don't have the laser system. But 10-20 साल में ना हर एक डॉक्टर के पास ये टेक्नोलॉजी आएगा. This is inevitable. जब मोबाइल फोन पहले निकला था, कोई उसका घर का फोन नहीं डाल दिया. अभी किसी के पास घर में फोन नहीं है, सबके पास मोबाइल है.
हाँ.
ऐसा 10-20 साल में ऐसा हो जाएगा कि पुराना जमाना बंद हो जाएगा, खत्म.
सही बात है. क्योंकि 40 सेकेंड्स में अगर हो सकता है एक आंख का ऑपरेशन,
तो फिर ये आंख इंजेक्शन दो, आंख काटो, ये सब खत्म हो गया है, फिनिश्ड.
लेजर में भी लेकिन ऐसे ही होता है ना?
नो इंजेक्शन, नो पेन.
नो, बट लेजर से किया तो फिर वो ऐसे ही होता है.
40 सेकेंड्स.
40 सेकेंड्स में होता है लेजर में भी, और उसमें इंजेक्शन भी नहीं देना पड़ता है लेजर से करे तो भी. तो रोबोटिक और लेजर में क्या फर्क है?
लेजर सर्जरी.
हाँ, रोबोटिक इज लेजर सर्जरी. ओके. तो इट्स गुड, नो, इन 40 seconds. It's very good. Thank you.
Hello, doctor.
हाँ जी.
My father is 86-year-old. He's been detected with floaters in his left eye.
Yeah.
So most of the ophthalmologists he visited.
Floaters are not a disease. Don't do anything.
Okay.
Leave it alone.
Achha, so nothing can be done as such.
Nothing is to be done.
What is it exactly? Like what happens in floaters?
It's old age.
Oh, that's it. I mean.
That's it. Don't do anything. It's not a disease.
Achha, so it's not. I mean, nothing can be done.
Leave it alone.
Okay. Anything more suggested for it, like
No.
Hello, doctor.
Haji.
I'm Deepa here. I'm 55 years old.
Yeah.
I will briefly tell you about myself. Actually, I was a very high myopic patient. I had -10 in both the eyes. So I underwent LASIK surgery around 15 years back.
Yeah.
And then later on, recently, some 6 or 7 years back, I developed glaucoma also.
Yeah.
So my worry is whether by aging, when I will develop a cataract also, would there be any problem in getting it operated?
No. With the new laser system, I can operate your cataract and also make you spectacle free.
Doctor told me that my cornea is thin, so they couldn't reduce the number.
They cannot do it. I can do it. They don't have the laser.
Okay, sir. I will take your number and right now I'm
my
not
number is on the chat.
Okay, I will take it down. Right now I don't have developed the cataract, but I have glaucoma. I'm taking the drops.
I can fix that also with the laser.
Okay, that's good.
Yeah.
Okay. I'm from Delhi. Do you come over to Delhi or we have to come over to Bombay?
No, I don't go to Delhi, but you can go to my friend in Delhi.
Okay.
At Dr. Mahipal Sachdev at Center for Sight.
Mahipal Sachdev.
Yeah. Sardarji,
Okay.
Mahipal Sachdev at Center for Sight.
Okay. Okay.
Yeah.
I will search it for him.
He
Okay.
will fix it. He has the same laser as me.
Okay. Thank you so much. Your program was very informative. Thank you
Yeah,
so
yeah.
much.
Thank you.
Any more questions? किसी और को questions
So
है?
if anybody else wants to ask me now, I'll have to get back to work. So you all send me a WhatsApp. I have put my mobile number there. Feel free to WhatsApp me. Just circulate this number to everyone.
Sure,
And
sure.
I will catch up with you guys later.
Can we just have a last question from my
Yeah.
side, and so we can end?
Yeah.
If you have a time, so we can go ahead.
Yeah.
Is it normal to come water from eyes? Usually when I walk in the afternoon, so I
No, it
don't
is
get
not
any,
normal.
it's not normal. So why does the water come? But usually
I'll have
when
to have a look. There are many, many causes for that.
okay, so when I walk in the afternoon, like in a sunny day, so there is no water. But when I go in Activa, so when I drive, so I can't drive properly. The water tears come.
Are you wearing a helmet?
No, I don't usually wear because for
That's the
short
problem.
distance near
You
to
have
my
to
home.
wear.
For a helmet. Okay.
You have to wear a helmet with a visor. Otherwise, water will come out.
Okay, okay, fine.
And if you fall down, your head will break. So you have to wear a helmet.
Yeah, surely I will take that.
The law has been made to protect you.
Yeah,
Not to take 100 rupees from the policeman.
no, for a very short distance, like, but I will take the
No,
precaution.
but you can fall down even in 1 meter.
Okay.
Please wear that helmet, madam.
Okay, sir. So on behalf of Graceful Living, I would like to say you thank you for your such a valuable time and efforts.
Everyone.
The session was very informative. मुझे पता है कि सभी इसी सेशन से सबको बहुत जानकारी मिली होगी. And we will surely share your contact details and if anyone have queries. And we will also share the link of YouTube video. So Doctor, thank you so much from Graceful Living.
Thank you.
Thank
Bye,
you.
everyone.
Thank you. Have a good day, everyone.
Thank you, doctor.
Bye.
Thank you.